This is our hygienist, Alexis. She's about to start a cleaning on her patient, Mrs. B. Mrs. B is an overall young and healthy college student who has dental anxiety. Let's see how this appointment plays out and try to spot the ethical dilemma that unfolds.
All right, Mrs. B, we're about to start your cleaning. How are you feeling?
I'm a little nervous.
Nervous? What makes you nervous?
Well, those power instruments make me uncomfortable.
There's nothing to be scared of, but I know what could help. Let me just grab something real quick. Here we go. Is there a problem?
Actually, is there another way we
No
could...
problem. Okay then, let's numb you up. Trust me, this will make you feel comfortable in no time.
I guess.
All right, let me take that off for you. And you could follow me to the front. Peyton here will schedule for your next appointment. See you in 6 months, Miss B.
Hello, Miss B. I hope your cleaning went well. Would you be available for a hygiene appointment on the 9th of September?
No, thank you. I won't be coming back to this office for any treatment in the future.
Oh no, did something go wrong today?
I mean, there was no problems with the cleaning itself. I just feel like no one listened.
No problems? Then why don't you want to come back for your next appointment?
Were you able to spot the ethical dilemma? It might be tough to see exactly what went wrong. The patient herself expressed that there were no problems with the cleaning, so what's the damage? What made the patient decide that they were no longer going to be treated at this office moving forward? There are values and concepts that are rooted in ethical principles, and conflicts between or among these values are to be expected. In this instance, the concept of paternalism and informed consent are at odds.
Let's start by defining paternalism. It's based on the approach of a healthcare provider taking up the role of a parent and making decisions that they believe are in the patient's best interest. Paternalism is closely linked to the principles of non-maleficence and beneficence. At first glance, this makes sense. After all, who knows more about oral health and disease better than a hygienist and a dentist? We are using our clinical judgment to make the best decisions for the patient's health. But what happens when you present the best treatment option to your patient and they're not fully on board? This is where the second ethical concept comes into play, informed consent.
Informed consent is based on the patient exercising autonomy and allows the patient to be involved in the decision-making process. Informed consent legally and ethically requires the provider to put all their cards on the table. For the patient to make an informed decision, they need all the relevant information regarding their treatment delivered in a manner that is comprehensible. So if a patient with a language barrier signs off every treatment being proposed, even a bad one, then their consent is invalidated since they didn't fully understand the terms of the contract.
In our scenario, even though Mrs. B relented to get numbed, she wasn't able to exercise her autonomy since she wasn't informed about all the alternatives to getting the needle. When the patient expressed her discomfort with powered instruments, the provider failed to educate her about other options such as Orachix application, hand instrumentation, or even just turning down the power of the ultrasonic instruments. Instead, the provider took the role of a parent and made the decision to use local on behalf of the patient. Although there were no complications and the provider was acting in the patient's self-interest to ensure Mrs. B was more comfortable during the procedure, it still violates the patient's autonomy and explains why the patient chose to never come back for another cleaning.
Accepting the decision of the patient when it is in conflict with what healthcare providers would most highly recommend is extremely difficult to handle and makes room for ethical dilemmas to take root. It's important for us to recognize that the patient has a right to informed consent, and alternatively, they have a right to make an informed refusal. Respecting the autonomy of individuals is important, even if it means watching patients refuse life-saving treatments. Knowing all this, let's play back this scenario and see how Alexis could have better handled this situation.
All right, Mrs. B, I'm about to get started on your cleaning. How are you feeling?
Nervous.
Yeah, visiting the dentist can be very stressful. What's making you nervous?
Those power instruments really make me uncomfortable.
Why do they make you uncomfortable?
Well, they leave my gums feeling sore and sensitive around my front teeth.
Well, there's a few things we could do to address this. I could get you numbed up so you won't feel uncomfortable when I go in with the power instruments. But I know how much needles scare you. If you're not on board with that, I could apply some topical anesthetics instead, or I could use my hand instruments. What would you prefer?
Oh, there's no injection involved with the topical?
Nope, no injections are involved. It's completely non-invasive and painless.
I'll go with that option then.
Perfect.
Hey, Mrs. B, how'd your appointment go?
It went well. I really feel like my hygienist listened to me and addressed all my concerns.
I'm so happy to hear that. Would you like me to schedule your next appointment for the 9th of September?
Yes, that works for me. Thank you.